Let's continue the points of the lung meridian. Lung 7, 裂缺. 裂 means a split or fissure. The meridian branches into the Yangming meridian from this log connecting point, which is located above the radial styloid process between the tendons of the abductor pollicis longus and the extensor pollicis brevis muscles, where there seems to be a fissure. Lung 7 is on the radial aspect of the forearm, between the tendons of the abductor pollicis longus and the extensor pollicis brevis muscles, in the groove for the abductor pollicis longus tendon, 1.5 cun superior to the palmaris crease. To locate lung 7, please abduct your thumb. You may find 3 obvious tendons attaching the thumb at the radial side and the dorsal aspect of the wrist. From radial to the ulnar, they are tendon of the abductor pollicis longus muscle and tendon of the extensor pollicis brevis and the extensor pollicis longus muscles. Lung 7 is in the groove between the radial 2 tendons, tendons of the abductor pollicis longus and the extensor pollicis brevis muscle, attaching the thumb with the radial styloid process. The 2 tendons are marked in red in the picture. Slide along the 2 tendons to the proximal border of the radial styloid process. Try to feel a fissure or depression between the tendons or between the tendon and the radial styloid process. You will find lung 7. You may think it's a little difficult to find the tendons. Here's a simplified method to help you locate lung 7. With the index finger of one hand pressing on the radial styloid process of the other hand, the point is in the depression where the index finger tip lies. The indications of lung 7 are: first, disorders of the lung, including cough and asthma. Second, facial problems, including toothache, sore throat, deviated mouth and eyes. Third, headache and nape stiffness. Some of you might be curious why a point on lung meridian is used to treat disorders on the head and face, where the lung meridian does not reach. Think it for a moment. You may find lung 7 is a specific point, log connecting point. It's where the collateral of lung meridian separates to connect with its interior, exteriorly related large intestine meridian, and the large intestine meridian reaches the nape and face. That's why lung 7 is so special in treating disorders of the head and face. In the famous Sum of 4 Major Points, it is said that for head and nape, 裂缺 lung 7 is selected. Lung 7 is especially known for its effect on nape pain and headache caused by externally contracted wind cold. It's also a local point in treating hemiplegia, pain in the wrist. As it's also the confluence point of the conception vessel, it's often used in combination with 照海, kidney 6, to treat disorders of diaphragm and throat, especially sore throat due to kidney yin deficiency. Needling method. Since the point is just over the radial styloid process and the skin here is very thin, it's recommended to puncture obliquely 0.2 to 0.3 cun towards the elbow. With the fingers of one hand, pinch up the skin over the point, and with the other hand needle, avoiding the cephalic vein. On August 15, 2006, an acupuncture anesthesia operation was performed in Shuguang Hospital, the affiliated hospital of Shanghai University of Traditional Chinese Medicine. In this pulmonary valvuloplasty under acupuncture combined with drug anesthesia, the doctor did electroacupuncture on lung 2, 云门, lung 7, 裂缺 on the lung meridian, and the pericardium 6, 内关, on the pericardium meridian. The anesthetic amount in this operation reduced to 2 combined with 15 phenetidine in general anesthesia. The acupuncture anesthesia finally reduced the surgical expenses and also the adverse events due to anesthetic. 狼奈太渊 Tai means big and Yuan means deep. This point got its name because it is the major meeting influential point where meridian qi gathers. Lang Nai is on the anteromedial aspect of the wrist, between the radial styloid process and the scaphoid bone, in the depression ulnar to the abductor pollicis longus tendon. It's where the radial artery pulsates. Lang Nai is used to treat lung disorders including cough, asthma, coughing blood, sore throat, pain in the chest. It's also the mother point among the 5 shu transport points of the lung meridian to tonify lung qi or lung yin. Since it's the influential point of the vessels, Lang Nai is used in pulseless syndrome, very weak pulse, not due to the abnormal anatomical allocation of the radial artery, but made due to arteritis, or in severe cases, the pulse is very weak. It's also used to treat local pain in wrist and arm. As a yuan source point, Lang Nai is often used in diagnosis and treatment. The spiritual pivot states, if the 5 zang are diseased, abnormal reactions will appear at the 12 yuan source points. By knowing the correspondence of the yuan source points to the relevant zang, the reaction can be seen, and thus one can identify which of the 5 zang are injured. The book also states, when the 5 zang are diseased, select the 12 yuan source points. Our research group did an experiment to detect the relationship between the yuan source point and its pertaining organ. We measured the pulmonary function of the patients with pulmonary dysfunction, and at the same time, we detected the infrared radiation of the 6 yuan source points. We found the correlation between pulmonary function and the infrared radiation of Lang Nai was stronger than those of the other yuan source points. The results showed that the yuan source point of the lung did reflect the physiological and the pathological characteristics of its pertaining organ, the lung. Needling, perpendicular insertion 0.3 to 0.5 cun. Precautions. Be careful to avoid the radial artery when needling this point. One finger can be used to slightly press the vessel towards the radial side, while the other hand inserts the needle along the radial side of the tendon of flexor carpi radialis. Avoid direct morsation at the artery and the 5 sensory organs on face. Lang 10, yu ji. Yu means fish, and ji means border. This point is at the edge of the abductor pollicis brevis and the opponent's pollicis muscles, where the muscles protrude, resembling a fish belly. Lang 10 is on the palm, radial to the midpoint of the first metacarpal bone, at the border between the red and the white flesh. That is the junction of the dorsum and the palm of the hand. Lang 10 is the in-spring and fire point of the lung meridian. According to the classic of difficult issues, in-spring points are indicated for heat in the body, and Lang 10 is effective to clear heat from both the lung meridian and the lung zang. The internal pathway of the lung meridian rises to the throat, and Lang 10 is a major point for a wide range of throat disorders characterized by heat and dryness, and is indicated for pain, swelling, congestion, and dryness of the throat and loss of voice. The indications are cough, asthma, coughing blood, sore throat, sudden loss of voice, fever due to lung heat deriving from yin deficiency or excess heat in the lung zone, needling, perpendicular insertion 0.5 to 0.8 寸, lung 11, 少商. 少 means little, and 商 is a lung tone, one of the 5 tones. This point is where lung meridian qi originates. Where the meridian qi begins, it is small like a stream, giving the point its name, 少商. Lung 11 is on the thumb, radial to the distal phalanx, 0.1 寸from the corner of the nail, at the intersection of the vertical line of the radial border and the horizontal line of the base of the thumbnail. Indications: sore throat. Both lung 11 and Yuji lung 10 have an important effect on the throat. The internal pathway of the lung meridian ascends at its highest point to the throat. At the terminal point of the lung meridian, Shaoshang lung 11 has a particularly strong action on the opposite end of the meridian. It's recommended to needle or prick to bleed in all acute disorders of the throat and the surrounding tissues due to excess heat and fire poison. It is also used for cough, high fever, nosebleed, sudden loss of voice. Second, unconsciousness, mania. In common with many of the Jingwell points, lung 11 is an important point to revive collapse, being indicated for loss of consciousness, for instance, from wind stroke, and high fever, cold, or hot inversion. According to the view of traditional Chinese medicine, most Jingwell points locate at the border between the red and white flesh, where the yin and yang meridians meet and connect with each other. Thus, stimulating Jingwell point can improve the exchange of qi and blood between the yin and yang meridians, which helps the communication and the balance of yin and yang, and helps refresh the spirit. According to the view of modern medicine, there are large amounts of ending nerves at fingers. Any small stimulation causes strong reactions. Thus, needling Jingwell points can revive unconsciousness. Due to its effect in treating mental disorder, it has an alternative name of 鬼性, ghost faith, among Sun Simiao's 13 ghost points. The last is a local point for finger numbness. Manipulation. First, needle superficially 0.1 to 0.2 寸. Second, bleed with a 3-edged needle. Before needling, push the blood to the fingertip and hold tightly. Then insert the needle into the point rapidly and expel 5 to 10 drops of blood. Mospastion. Use 3 to 5 coins of rice grain size mospastion or use a mox stick for 5 to 10 minutes. That's all for the points section. Last, let's have a brief summary of the points. First, please summarize the major function for the following points on your own, considering their characteristics as a specific point. You can find the answer in the next slide. Next, pay attention to the needling and mospastion methods for the following points, considering their anatomical location characteristics. That's all for today. Let's do more practice on points location after class. Thanks for your attention.